Hello everyone, welcome to another daily program on Health Corner from Esteem Radio Vision, Oboko Avenue, Ilesha, Osun State. Like I would always tell you, you should always prioritize your health. It's very, very important. Let's make sure that when we feel sick or any slight pain in our body, you go to the hospital to check it out. Don't do self-medication. Eat healthy, take lots of fruit and stay hydrated. I would always hammer that on you guys. Stay hydrated always. And an appreciation goes to the executive producer in person of Dikin Michael Adeboye Ashaolu, and to every esteemed members and the man behind the console, Big Balo. And my name is Olamide Arubola, and with me here is the prince on the show.
All right, thank you, Olamide, for beautiful introduction. Adenipekun, Afolabi is my name. We are saying to you, always ensure that you prioritize your health. Health is wealth. All right, like the normal things that we do on the Health Corner is just for us to talk about our health, what we need to know that will be of help to every one of us. On today's episode, on the Health Corner, we have a particular topic that has to do with life. Sometimes if you have malaria like the one we've treated, and you have hypertension, you can still work on it, either hyper or the low one. You can still work on it and get rid of it. But this particular one that we want to talk about is a thing that between life and death. That is why we need to know. Peradventure, we find ourselves, but we don't pray to find ourselves in such situation. But peradventure, you find yourself in such situation, you'll be able to know what next to do as a first aid or quick action, just for you to resuscitate the baby, or the baby back to life. That is why we bring to you today the birth asphyxia. That is what is our topic today, birth asphyxia. And as usual, we have with us on the line right now, that is our nurse Nwoko, Ezinne Mary Constant. Good evening, Nurse Nwoko.
Good evening, Mr. Afolabi. Good evening, Olamide.
All right, thank you for joining us once again.
Thank you. I'm most delighted to be in your midst.
Okay, now what we want to discuss, yesterday we talked about the malaria and how it can affect the pregnant women, even not only pregnant women, generally, and we focus more about the women because you told us that if malaria persistence in a pregnant woman, it can lead to a lot of issues. But today, what we want to talk about is the birth asphyxia. Now, to me, as a layman, or in layman definition, what I know it is maybe a particular child is unable to breathe and normal as it's supposed to be. You as a health practitioner, we want you to shed more light to expatiate on this particular topic, that is birth asphyxia.
All right. As a form of introduction, I would like to tell all of us that birth asphyxia is a medical condition to start with, and it happens in newborns. It's a situation whereby a newborn fails to initiate or maintain adequate breathing at birth due to lack of oxygen. And this lack of oxygen can be known as, in a medical terminology, as hypoxia. It can also be as a result of poor blood flow, which is ischemia. Then it can happen before, it can happen during, it can also happen immediately after delivery. And it is one of the leading causes of neonatal death and long-term neurological disabilities, especially in people that have low income resources. So birth asphyxia is in a nutshell failure of a baby to breathe or cry at birth because of impaired gas exchange that as a result of hypoxia, hypercapnia, or acidosis. Thank you.
Okay, now you talked about the lack of oxygen. Is it the lack of oxygen you are talking about? Is it for the mother or for the child or the baby?
For the child, for the baby.
Okay. Now, what you are saying now is that for a baby that is still in the womb of the mother, is it right in the womb or after giving birth is what we are talking about?
It can happen, like I said before, it can happen immediately before birth, during or after delivery. Either time, it can happen any of this period.
Okay. All right. Now let's look at this. Why is birth asphyxia a major public health concern? Why?
Okay. It's a major public concern because of its mortality and morbidity rate worldwide. It accounts for about 900,000 newborn deaths annually. That's the estimate. And it occurs more in people that have low income, middle and low income sources. It is also a significant cause of long-term neurological disability, something like cerebral palsy. Its cause is a condition that is of concern. That is why is a public health is of a public health concern. The mortality rate is high. The number of people that comes down, number of babies that comes down with asphyxia is up to 900,000 globally annually in a year. So it's quite a huge number, and it happens among the low income earners and middle income earners. And it can cause what we call the cerebral palsy, which is not a good condition in a baby. Thank you.
Alright, thank you so much for that, ma'am. So, ma, what's the difference between birth asphyxia and hypoxic ischemic encephalopathy?
Encephalopathy.
Okay, ma. Thanks for the correction.
All right. So, I said that birth asphyxia is inability of a baby to cry or breathe due to impaired oxygen exchange or as resulting in hypoxia, hypercapnia, or acidosis. While hypoxic ischemic encephalopathy is a type of injury to the brain that was caused as a result of inadequate oxygen and blood flow around the time of birth. While birth asphyxia is an inability to breathe or maintain breathing or even cry due to poor exchange of gas, that is the exchange of oxygen, hypoxic ischemic encephalopathy means the injury to the brain that is caused as a result of that inadequate oxygen or blood flow at the time of birth. Hypoxic ischemic encephalopathy is a kind of a complication of birth asphyxia. That is just the difference. Just put it in that nutshell. When the baby fails to maintain or breathing or breathe or cry at birth, the next thing you are going to see is what we call hypoxic ischemic encephalopathy. The brain becomes injured due to lack of oxygen and blood flow. Thank you.
All right. Thank you for that response. And my question is it compulsory or mandatory for a baby to cry after birth?
Very, very compulsory. Yes.
Why?
Because it is the cry. When he or she cries, he will be able to take in oxygen and exhale carbon dioxide, and the lungs will expand. The lungs will start working, because when he was still in the mother's womb, the lungs are not working. They are dependent on the gaseous exchange from the mother. So when the baby cries, the lungs take up the responsibility of breathing. A lot of things happen. The shunts in the heart close. The foramen ovale, the ductus arteriosus. Let me not just start mentioning the terminologies. But what I'm saying is that it is very necessary for the baby to cry at birth. It is both necessary for the lungs, for the heart, and for the proper functioning of everybody. If any baby that does not cry, you find the new midwife or the birth attendant beating him or her to start crying, so that that's the only way you can see proper blood circulation. The cry of a baby is dependent on is so important that it makes the midwife comfortable that this baby is a normal baby. If any baby that does not cry, that means the baby is not alive. He has to cry, and you know, so that a lot of good things will happen. A lot of things will happen in the lungs and in the heart. That is of good, of beneficial. That is of benefit to the baby and
Okay.
in his or her development.
Okay, if a baby was unable to cry out, can we say this is as a result of maybe the condition, the health condition of the mother?
Well, yes, a lot of factors. It could be the health condition of the mother. It can also be as a result of as a result of malpractice. Will I put it that way? Inability of the midwife or who better attendant that is attending to the woman to monitor the labor very well. It could result from both sides, both from the mother and for the person handling the delivery.
All right, ma. Thank you so much for that, ma. So, how common is birth asphyxia globally?
How come?
How common is it globally?
Okay, okay, globally, like I said before, globally, it accounts for about 900,000 newborn deaths annually. So globally, it has a huge a huge effect. It has a huge number of occurrence. So it's of a significance. That's why we are studying it today. That's why we are talking about it today. It's a common symptom, a common medical condition that you find among low income earners and middle income earners. So, like I said, the data I have is statistics has is that they have up to 900,000 newborn deaths annually because of birth asphyxia. Thank you.
Okay, with this now, why is the burden high in developing country?
I didn't get the question.
Okay, my question is this: the asphyxia that we are talking about, why is it the burden high in the developing countries?
Okay, like I said before, I told you that its occurrence is more in low income earners and middle income earners. And you find out that in developing countries, that is where you have low income earners and middle income earners. So the population in developing countries that are of low income earners are more. So that is why you have it in developing countries. Thank you.
Okay.
All right, ma. Thank you for that, ma. So, what antenatal conditions can cause birth asphyxia?
Well, antenatal causes of birth asphyxia, that is before labor, include things like maternal hypertension or preeclampsia. You have severe maternal anemia. You can have maternal infections. You can have placental insufficiency. You can have post-term pregnancies. All these can cause birth asphyxia before labor. All these can cause birth asphyxia before labor, during or before labor, before delivery of the baby. So things like maternal, that is why we talked about hypertension. We talked about, you said somebody asked a question if it can happen in a pregnant woman, and we said yes, that it is called preeclampsia. So this preeclampsia can actually lead to birth asphyxia if it's not well managed. We also have severe maternal anemia. When a mother's blood supply is reduced, it can affect the baby's brain, can affect the baby's breathing and ability to cry after birth. The baby may come out floppy or almost half dead. We also have things like maternal infections, placental insufficiency. What I mean by placental insufficiency is inability of the placenta to receive enough blood to sustain the baby in utero. So if the baby is not well sustained when he was inside the womb, when he or she is coming out, he could come out with this condition known as birth asphyxia. Thank you.
Okay, thank you. With this, who is more at risk of giving birth to a baby with asphyxia?
There are a lot of people that are at risk of having birth asphyxia. People like teenage pregnancies, teenagers, most of the teenage pregnancies are really unwanted pregnancies. So most of them don't attend antenatal clinics. So they carry their pregnancy hiding especially the early stage, they'll be hiding it. They will not take their medication, they will not take good care of themselves, and the baby will be suffering when the baby comes out. it can come down with beta asphyxia. Then also in multiple gestation, when we have twins and triplets, they can have beta asphyxia because they don't have enough of everything. They are because they are sharing both blood, they are sharing gaseous exchange, they are sharing placenta. Is a high risk, is a risk factor for more beta asphyxia. Then poor antenatal care. If the woman was not well taken care of when she was pregnant during antenatal period, the babies can come down with beta asphyxia. Then the maternal diabetes. If a mother had diabetes while she was pregnant, it could lead to beta asphyxia when she delivers her baby. Then prolonged rupture of membrane. If a woman was pregnant and she ruptured her membrane without labor starting almost immediately or as at when due, it can lead to beta asphyxia because the baby will be compromised. They could get infected because of prolonged labor and all the rest of them. Then maternal smoking or use of drugs. Any mother that smokes or uses drugs is at risk of exposing the baby to what we call beta asphyxia. The baby may not do well when he or she comes out. Then low birth weight. If a baby is low birth weight, if the baby is less than 3.5 kg at birth, is a risk factor for the baby to have beta asphyxia. Thank you.
Okay, thank you. With this, okay, for a woman who have a multiple pregnancy, like having twin, maybe the first delivery is twin, and maybe the second time that she got pregnant, same thing with twins. Can this be part of the risk?
Say that again.
Okay, what I'm saying is that having multiple pregnancy, like maybe the first one that the woman got is twin, and later on she want to give birth, and same thing is twin. Can this be part of the what I mean with the risk of getting
Yes,
asphyxia?
yes, 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 yes. When a woman is almost having twins, like I said, twin pregnancy is a risk factor. Is on its own. It's a risk factor for having beta asphyxia. Is a risk factor. Yes.
Okay, all right. Thank you for that beautiful response.
Ma, so what happens?
You're welcome.
What happens in the baby's body during asphyxia?
Right. It's known as the pathophysiology of beta asphyxia. During beta asphyxia, we have what we call reduced oxygen. And this reduced oxygen is also known as hypoxia, which is low oxygen supply. During this period, there is a low blood supply, low oxygen supply, there is what we call aerobic metabolism and anaerobic metabolism. What happens in aerobic metabolism is there is enough oxygen, so the normal process takes place. There is no deposition of anything. But in anaerobic metabolism, because of low oxygen supply, there will be deposition of what we call lactic acid, which is also known as lactic acidosis. Then, because of poor blood perfusion to vital organs, the brain may be impaired. Then the heart pumping function will be altered. Then kidneys will have acute injuries. The lungs also will be impaired, and if not corrected, secondary energy failure occurs at later hours, worsening the brain injury. So the things that happens during beta asphyxia can affect the brain, it can affect the heart, it can affect the lungs, it can also affect the kidneys. So because it's affecting the lungs, that is why you are having impaired breathing. You find it difficult, the baby finds it difficult to establish breathing and also to sustain breathing. So what in a nutshell happens is that there is a reduced oxygen supply, and because there is a reduced oxygen supply, there will be metabolism. The metabolism now will become an anaerobic type of metabolism. That is the breakdown of substances. So as a result of the fact that it is not something that is oxygen enhanced, there will be deposition of lactic acid. And because lactic acid is now deposited into the body of the baby, it can affect the brain, which will lead to hypoxic ischemic encephalopathy. It can affect the heart. It will reduce the rate at which the heart pumps blood. Then it can cause kidney injuries and also impaired breathing in the lungs. Thank you.
All right, ma. Thank you for that, ma. So, what neurological symptoms suggest HIE?
All right, things like seizures, HIE in a nutshell means hypoxic ischemic encephalopathy. Things like seizure is a neurological sign that a baby is having hypoxic ischemic encephalopathy. Lethargy, that's lethargy, poor sucking reflex, abnormal muscle tone, either the baby is floppy or stiff, and other levels of consciousness. If the baby is unconscious, becomes semi-conscious or unconscious, is a sign that the baby is having hypoxic ischemic encephalopathy. So when you see any of these signs, the baby is having seizure, that is shaking or convulsing, like people will call it, but the proper name is seizure, or having poor inability to suck very well, the sucking reflex is not there, then the muscles are either floppy or stiff, and the baby is a little bit unconscious or semi-conscious or totally unconscious. Anything that affects the consciousness of the baby, all these things can point towards the fact that the baby is having hypoxic ischemic encephalopathy. Thank you.
All right, ma. For those people that doesn't understand what lethargy is, what's the meaning?
Lethargy means that's poor. The baby becomes cranky, and if you cry, cries. The cry is not adequate. Like is very weak cry,
Like all this
and
crude something they call it.
yes,
Okay.
like what?
They call it crude. Those babies that doesn't cry like normal babies do.
Yes.
Okay.
Some it can also, if the cry can be in either way. It can also be high pitched cry.
Okay.
If it could be high pitched cry, it is not a normal cry. It's not a normal cry. Yes.
All right, ma. Thank you for that, ma. So
Yeah.
how is the?
Yeah.
I don't know if is it APGAR? Does it have a full meaning? Like what? How is the APGAR
Yes.
score used in diagnosing asphyxia?
Okay. APGA score. APGA is the name of the person that found out this scoring system.
Oh,
So there
okay.
is a name of a person, and
Okay.
it's also an acronym.
All right.
The A stands for appearance, the P stands for pulse, the G stands for grimace, the R stands for respiratory, the other A stands for what's it called? The muscle, the reflexes, the muscle tone.
Okay.
Hmm. So APGA is the name of the person that discovered the scoring system.
All right.
So APGA is used to assess the breathing, the heart rate, the muscle tone, reflexes and color, just like I mentioned before, at 1 minute and also 5 minutes after birth. So during birth, immediately after birth, a minute after birth, you can check the baby's system. You can score the baby using APGA score. You can assess the baby using APGA score. So if the baby has a score of 7 to 10, the baby is a normal baby. If the baby has a score of 4 to 6, the baby have what we call moderate asphyxia. Then if the baby scored between 0 to 3, the baby has severe asphyxia. So it's a scoring system, is a system used in scoring, making sure that the baby is normal before you, or that will allow you to know what to do or know whether the baby is having asphyxia. So like I said before, if the baby have a score of 7 to 10, the baby is a normal baby, there is no asphyxia.
Okay.
But if the baby has a score of 4 to 6, the baby is moderately asphyxiated. Then if the baby is scoring between 0 to 3, the baby is severely asphyxiated. So, and what you are really scoring, what you are assessing is for color, breathing, heart rate, muscle tone, reflexes, and color. And for each of these scoring system, you score them a score of 2. So there are five. There are five things you are scoring, and each of them carries a mark of 2. So if you get to appearance, that is color, you can score 2 or 1. So in that order, with breathing 2 or 1, heart rate 2 or 1, muscle tone 2 or 1, or even 0, depending on if they are there or not. So, and whatever you score and whatever you give the baby at the end of the 5 minutes or 1 minute, you total it and If you get a score of between 7 to 10, you know that the baby is normal. If you get a score of between 4 to 6, you know that the baby is moderately asphyxiated. If the baby is scoring between 0 to 3, you know that the baby is severely asphyxiated, and you have to do something immediately for a moderate asphyxia and severe asphyxia. You have to intervene so that the baby does not, kind of pass away.
All right.
Thank you.
Thank you.
Okay, thank you, Ma, for that response. My question now is that if someone have this, experience this asphyxia that we are talking about, what is the immediate management of the baby who does not breathe at birth?
What is the immediate?
Immediate management of a baby who does not breathe at the birth.
Okay. The immediate management of a baby who does not breathe at birth follows what we call the neonatal resuscitation protocol. And what you are going to do in this protocol, the first thing you are supposed to do is to provide warmth and dry the baby. Stop crying. What you're supposed to do is to provide warmth and dry the baby. Then you can clear the airway, that's the nostrils and the mouth. You clear the airway by suctioning it. Then you stimulate the baby by tapping the baby. Then you maintain what we call the positive pressure ventilation within 1 minute. You can now give chest compressions if the heart rate is less than 60 beats per minute. Then you provide oxygen. You can give oxygen through through the nasal prongs, so that the baby will be well oxygenated, so that the brain will not be damaged or lead to hypoxic ischemic encephalopathy. So all these things are what you will do immediately you find out that the baby is asphyxiated. So you follow these protocols: warm the baby, clear the airway, stimulate the baby, give chest compressions, and provide oxygen as needed. Thank you.
Okay, now I want us to look at the giving chest compression if the child doesn't breathe the way it should be, or if he or she didn't cry out. Now, with this, you talked about that giving chest compression. Won't this affect the bone of a newborn baby if we carry out that exercise on the baby?
Well, for a baby, the compressions, you don't do it as the way you do for adults. For the baby, you wrap your two hands around the baby's heart. You use your thumb to press the heart. Use your thumb, your two thumb. You don't use your palm like you do in adults, like you press in adults. You just use your two thumb and be pressing them. You give with your thumb. You wrap your hand around the baby with your two hands around the baby and use your thumb to be compressing. You don't use your whole palm to do the compression, so it's not going to harm the baby.
Okay, that is where the area I need the clarification, because some people may think maybe be the way they resuscitate the adult, that is the way they will also use for a baby, because their bone is still fragile, unlike the adults. Oh, yes. Thank you for that explanation. I believe for those who are listening to us, watching us right now, you will agree with me that it is not the way like our professional nurse advise us now, that it is not the way we resuscitate adults. That is how we do or apply to a newborn child, in order not to damage their bone, because after resuscitating the child, that bone issue will not be the one that you spend your money on, how to readjust or to reset the bone. Thank you so much for that beautiful response. And what is done after successful resuscitation?
Well, after you have resuscitated the baby, you have to maintain the baby. You have to maintain the temperature of the baby. Make sure it's within normal range. Then you have to maintain the sugar level. You monitor the glucose level. You do a glucose check and make sure the baby is not having hypoglycemia. Then you treat the infection. You treat infection if there's any infection. Of course, whenever a baby comes with asphyxia, you have to treat the infection, because you have to cover him, because he has been exposed to a lot of things. Then you provide oxygen. That's what we call CPAP, continuous positive pressure. we call it, you can use it to, you can establish it for the baby if there is a need. Then you have to control seizure. If there were a few seizure in the baby, if the baby was convulsing, you have to give something to stop the convulsion. Then you have to support the blood pressure. You have to initiate therapeutic hypothermia in babies with moderate or severe hypoxic encephalopathy. For babies with severe to moderate hypoxic encephalopathy, they need a kind of a lower temperature. They don't need high temperature to maintain them, so that they, especially around the head area. So you have to do that so that the encephalopathy will not get worse in the baby. So it's not all about resuscitating them. After resuscitating them, you have to maintain them in a normal temperature, maintain the blood glucose, treat infection, and provide oxygen or CPAP if there is a need for it. Thank you.
All right, ma. Thank you for that, ma. So how can this birth asphyxia be prevented before labor?
All right. It can be prevented through quality antenatal care. If you go for antenatal care, if you receive your go to a good hospital where you have a good midwife who gives you antenatal lectures almost every week, at least one lecture every week throughout the period of pregnancy, you can prevent birth asphyxia, because he will teach you what to do to prevent some illnesses that can lead to neonatal asphyxia, birth asphyxia, or tell you the things you need to do that can prevent things like anemia or control hypertension, diabetes, and monitor the fetal growth. So your midwife will be able to teach you all you need to know. Then if you are already anemic, she will help you to correct the anemia by telling you what to eat and what not to eat. Then if you are hypertensive, she can control it for you so that you can have a healthy baby. Then if you are diabetic, she and the doctors working with her can control it also so that you can have a healthy baby, even with the diabetes and hypertension. They can control it with medication so that you can have a healthy baby. Then you can also monitor your fetal growth, know whether your baby is doing well or not, so that they will know when and how to intervene, and when to establish or when to institute labor if there is need for that. Thank you.
Okay, thank you for that beautiful question. Before we wrap it up on the show today, what determines a baby's outcome after birth asphyxia?
Well, the severity of oxygen deprivation and how quickly and effectively you resuscitate the baby, that is what will determine whether the baby will do well, whether the outcome of the baby, whether the baby will be a viable baby or not. Then also, you have things like, if there was a presence of hypoxic ischemic encephalopathy, the availability of intensive care units where they can be managed, then mild cases can also recover fully, but severe cases need a very severe, a very drastic intervention, or else it can result in disability or even death. So the outcome is good in mild to moderate cases, but in severe cases, it can lead to disability or even death. So the prognosis of the birth asphyxia is good if it is mild to moderate, and with good intervention, quick and effective intervention, the baby can come out well. But if there is already hypoxic ischemic encephalopathy and the baby was not well attended to and promptly, it can result in permanent disability and death or death. Thank you.
All right, thank you for your response. And lastly, before we go on the program today, apart from the preventable antenatal or good antenatal, what other things that you want the people to take home as advice?
All right. My advice to everybody is that, to the public, is that birth asphyxia is a preventable medical condition. Apart from antenatal care, you should make sure you go to a very good hospital. Like I said before, stop patronizing birth attendants, traditional birth attendants. They are not midwives. They are not gynecologists. They don't know when to intervene. They don't know when not to intervene. They just do their things out of try and luck. Maybe you can work from the some of you will now say, am I saying birth attendant? Some of them deliver there. You can go there and deliver safely because you have all because you are normal. Everything about you is normal. But when there is a problem, you find out that there will be they won't know what to do and you will die in their hands. You won't remember that there are people that are going there and they are dying. So what I'm saying is this: apart from good antenatal care, skill delivery is a proper is necessary. And there's a saying that it's not all the babies that can come with their head. Some baby can come what we call breech. They can come with the buttocks instead of the head. So yes, it is the skill of the midwife to deliver that baby very safely. If you don't have the skill, you might break the baby's head, leg, or hands, or make the baby to have this. Some people they deliver them, their hands will look like as if it's hanging. It can't come down. It's as a result of poor skill delivery. So when you patronize all these traditional birth attendants, you can see a lot of things. A lot of things can go wrong. Don't take because one or two cases came out safely because they were normal delivery. And you say yes, Mr. A, Madam A delivered there. I will still go there and deliver. You are risking your life. Please stop patronizing them. So apart from proper skill, then proper monitoring of the labor. Like I said yesterday, when we talked about there was the discussion we had previously, I talked about what we call pathograph. When we talked about labor, I talked about pathograph. The pathograph is what will help you to alert you to know when to stop the labor and take this woman for surgery. When you find out that the labor is no longer progressing, it's the pathograph that will tell you, see, you are getting to alert line. Take this woman for surgery so that the baby can come out and the mother can come out. Then when there is already that birth asphyxia, if you are in a traditional birth attendant, they won't know what to do. But if you're in a good hospital, they will have a prompt neonatal resuscitation. They will know what to do, what to give, how to go about it, and it will be done very well. And the baby will come out, he will recover from whatever thing that would have made him or her to die. Then early action also by the midwife will save life and prevent long-term disability. So all these things, apart from antenatal care, is all what you need to do. So the ball lies in your hands, the hands of the medical practitioner, the midwife, the good hospital, and all that you need to do to deliver a good and sound baby. So if you are not in a good hospital, you didn't attend a good antenatal care, you find out that this skill delivery, proper monitoring, prompt antenatal resuscitation, neonatal resuscitation, and early action will not be given to you. And you find out that at the end of the day, it's either your baby is a vegetable, or have one or two disabilities, or he or she dies, and which is not good. So please, my sincere and candid advice is for you to please attend good hospitals where you have a good midwife and a gynecologist. Stop patronizing quacks and traditional birth attendants. Thank you.
Thank you so much for that. And to everyone watching us, I'm very sure you've learned a lot from today's topic. And like Nurse Nwoko said, stop patronizing all these traditional birth attendants. It's very necessary for you to go to the hospital directly when you know you're about to give birth to avoid all these complications. Thank you so much for today, ma. Thank you for
You're
imparting this
welcome,
knowledge to us,
Olamide.
ma. Thank you so much, ma. And to everyone
You're
watching
welcome.
us,
It's my pleasure, Olamide.
yes, ma, you're welcome, ma. And to everyone watching us, we say thank you very much. Thank you for staying to the end of the program. And as you all know, we will keep bringing all these daily health topics to us. So we have to like learn from them and pick from them in order to avoid making mistakes in our in our lives. So, and a special thanks goes to the executive producer in person of Dike Michael Adeboye Ashaolu, and to every
popularly called
Omoyala Kara,
who is also the founder,
yes, of
Adenipekun
Benipole Foundation. He sponsored this program as well. And to every esteemed members, and to the man behind the console, Big Balo. And I still remain myself, Olamide Arubola, and with me.
All right, thank you, Olamide. Like Nurse Nwoko said, early action save life and reduce long time disability. Let's take action when we're supposed to take action, and like she said, do not patronize quack or bed attendants. All right, Adenipekun Afolabi is my name, your prince on the show. I'm saying to you, bye. Till tomorrow that we will meet once again, I'm saying do have for yourself a wonderful night rest. Bye for now.
Rest that keeps you whole. Wellness isn't pressure, it's a gift to your soul. Welcome to Health Corner. You flow with the rhythm of care, where your body finds comfort and your mind gets air. Health Corner, let the melody guide you through. Every little habit builds a better you. From the meals that you choose to the sleep you defend, from the peace that you chase to the strength you